Hi, MCAT. What you doing this morning?
This is MCAT. He's a 15-year-old domestic short-haired cat.
He actually lets us do pretty much anything that I want.
We picked him up at the Humane Society when he was an adult.
He's just a sweetie. And the reason his name is MCAT is because he has a large M on his forehead.
Recently, I did notice that he was urinating inappropriately. He started urinating outside of the box, and he would get in the box several times and not produce any urine at all.
Oh, good morning.
So I decided to call my veterinarian, and they said to bring him in so that they could get a urine sample, or I could try to get a urine sample at home.
The first thing we want to do is check a urine sample, and the way we do that is basically put a needle into the bladder. That'll be the first thing that we want to test for. Now, if that test comes back and there doesn't show any signs of urinary tract infection, we want to do some blood work as well, checking the kidneys, making sure we don't have a kidney problem, either kidney stones, sometimes kidney infection can cause them to drink a lot of water and urinate more as well. So if all of that comes back normal, then we start to worry about stones being in the bladder. And to find that out, there are two different ways. We can either do an x-ray of the abdomen and we can see the stones, or we do an ultrasound and then we can see the stones and can't really count them, but we can see that they're there.
He had these small 2-3 millimeter rocks actually in his bladder. Once stones start to form, they can continuously form and get bigger. They can cause a blockage. The cats could actually die.
So there are two ways to get rid of these stones. One's either surgery, which is a risk in an older patient, or a lot of times we elect to do a diet trial and then ultrasound in a month. And if the stones are getting smaller, then we just keep them on the diet until we don't see any stones any longer. We change the pH of the urine and the stones dissolve. So that's what we're going to try in this case.
We wanted to try the food first instead of jumping into surgery. So we put him on food called SD, and he didn't really like the food.
Yeah, what? You don't like the food? This will make your stones dissolve.
So we decided to switch to this Royal Canin diet.
Bye. Thank you.
So MCAT's been on this Royal Canin diet for about 3 weeks now. Usually want to ultrasound after about 3 weeks to a month, and we're checking to see if the stones are gone. So looks like right now there aren't any stones. So the diet's worked. We usually like to keep them on this diet for another month, and then after that we re-ultrasound. If the stones are gone, then we can get them off of this really specialized diet and put them on one that will help prevent stones from forming at all.
He's very happy, and I'm very happy that he didn't have to have surgery.